Dr. Bowman, it's so great to have you on DHA's webinar series. We're bringing together the best physicians in the industry covering critical conditions. And I'm so excited to hear your presentation today on the copper hormone connection, and hidden drivers of anxiety and other chronic illness and disease in women. Before we get started, why don't you tell me a little bit about how you got into functional medicine and what you're doing now in practice?
Oh, in actuality, there's a couple of things that got me into this. It was both women's health as well as pediatrics. Okay, I was a little appalled when a 4 or 5-year-old male walked into the office, and the only way they could control this kid was with psychotropic medication as well as ADHD medication. And I said, no, somehow this doesn't seem right. This kid is only 4 years old. I can't imagine writing a prescription that's going to manage this child. By the time he's 7, he's not going to have a brain. And so there must be something else that we can do here. Can we approach it from a natural standpoint? And so through the research that I did, trying to find some other way to manage this kid, I came across the Pfeiffer Treatment Center where William Walsh was the founder and who was doing amazing work with children as well as adults in terms of biochemical imbalances. I said, surely there must be something here that'll work for this 4-year-old. And so through the research of that and calling the facility itself, I also found out that they were looking for physicians to kind of train the natural process of biochemical individuality to help folks who were really having some struggles. And so I bought into that. I was very interested and extremely passionate about how to help kids particularly. And so that being the case that it was, I signed on board, went through the training. Before you know it, okay, I'm here. I haven't looked back. It's been 20 years. So the copper hormone connection, hidden drivers of anxiety, mood disorders, and chronic illness in women. This is one area that I was very, very curious in relative to many of the women that wanted either birth control or hormone replacement, because they noticed, particularly with hormone replacement, that things were really changing. And as you may or may not know, every single cell in your body has a estrogen receptor. And this is where estrogen comes into play in terms of how and why this matters. And so this is one thing that I actually studied with Dr. Walsh and did a study to find out what kind of chemical imbalances and how does your biochemistry change as you get older, so that anxiety, mood disorders, chronic illnesses in women come into play. So let's see if we can move forward a little bit so that I can explain a little bit more of that. So some of the things that really happen with women. First of all, let me kind of explain the estrogen whole menstrual cycle in terms of why this is important. And I think most providers will know every month there's an estrogen surge because that's how it happens. Estrogen surge happens. When that happens, believe it or not, your biochemistry actually changes. It changes so that your body will actually utilize and bring in and hold on to any copper that it can find for the production of blood vessels. And if you don't know that, copper is necessary for the production of blood vessels. Well, in your uterine lining, this is absolutely necessary because if there's a fertilization that month, this little embryo needs to embed into a luscious, very lush sort of vascular tissue that's going to help it grow and develop into a baby, i.e., no blood vessels, no baby. Okay, that's how that goes. However, if there's no fertilization that month, then it is sloughed off and there's the uterine slough off or bleed, the menstrual cycle flow. That is how that actually works. And so then we get into a little bit of a problem now because there are two sets of women that tend to be, one, the estrogen dominant woman, or just normally estrogen managing woman, which is fine too. We all hope to be that. There tends to be at least half of us out there that are actually more or less kind of estrogen dominant. With that particular woman, some of the tendencies of what happened in terms of how she presents with symptoms tend to be things like this: heavy menstrual cycles, postpartum depression, postpartum psychosis, sometimes breast cancer, and I'll talk about that a little bit later because it has another component that kind of comes with that, but endometriosis, fibroid tumors, ovarian cyst. So now what really comes into play in terms of things that have connection are things like endometriosis, fibroid tumors, heavy menstrual cycles, ovarian cyst. This is where this I could say overdevelopment of blood vessels tends to support tissue, female tissue. And so for every menstrual cycle that happens, there tends to be a little more bleeding than expected. There tends to be some development of endometriosis where normal tissue tends to kind of flake off and embed in certain areas in the abdomen, such that when there's a menstrual cycle, that tissue also bleeds, and that becomes very, very painful. I think many women who have really experienced that are very much aware of the painful scenario that kind of goes on with that. Fibroid tumors, generally normal tissue, and instead of your uterus looking like basically a pear, it might look like Mickey Mouse. It might look like something a little abnormal, but not the perfect little pear that it should be. And that's because the bulking up of more normal tissue is there simply because estrogen has gone up, copper has gone up. The development of blood vessels is also supporting tissue. And so you get this irregular formation. And not only that, for every menstrual cycle, there's extra bleeding. And so all these things have a little bit of a relationship relative to estrogen dominance, copper toxicity, or overload. And we're going to talk about all of those things. So let me go to the next slide. Okay, so why? This is a slide of causes of copper overload. Why did these things happen? There is something called metallothionein. Believe it or not, everybody's supposed to make that, and we generally all do. But what it does, it regulates minerals and metals into their appropriate percentage. They all have to be there in their exact percentage of what needs to be. Otherwise, you're going to have some difficulty regulating heavy metals as well as minerals and metals that should be there. And so if that happens and you're an estrogen dominant female that has a metallothionein mutation, you may have some difficulty with that. And so you might be at risk of developing those things we talked about in the previous slide. So it says endometriosis, heavy menstrual cycles, fibroid tumors, that kind of thing. So let's move on a little bit. Oh, and I did mention this one, but this is very important. The estrogen dominant female, whether she's naturally estrogen dominant or imposed by birth control pills or even hormone replacement, if she is in that category, it's a very real possibility that she would have something like copper dysmetabolism. So let's move on a little bit. Okay, reading this one, elevated copper levels tend to lower dopamine levels, increase norepinephrine in the brain. Well, let me just kind of talk about it a little bit. Aside from being associated with some of these things that you see here at the bottom, what's really going on here is that it's interesting. In everybody's medical school book, there is a formulation that says, dopamine in the presence of copper turns into noradrenaline and then to adrenaline. Well, that in and of itself is going to produce kind of like the sympathetic nervous system over response, maybe anxiety, maybe panic, okay? And so that heightened sense of excitation is not one that most people are actually very comfortable with. And a part of the reasoning for that, I should say in part indeed, is because of copper overload. And when it comes to women, it's more or less the estrogen cycle that is playing into it. And so unfortunately, and most women really can relate to this particular statement, oh goodness, you seem more irritable today. Your mood demeanor seems to be a little bit over the top. Are you on your cycle? It's kind of like an aggravating point and an irritant to hear that kind of thing. But believe it or not, what they're noticing is actuality what's going on from a biochemical standpoint in changes in hormone and what's going on there. So anyway, it's not something we all want to hear relative to mood and demeanor changes that people are noticing, but there is actually a reason as to why that's going on. So let's move on. Okay, so here you go. Signs and symptoms of copper overload. You can kind of look at this list. I don't have to go through everything, but this is indeed what a lot of people experience. Not necessarily all of the above, but a lot of it. So acne, anxiety, anemia, bipolar disorder. Yes, indeed, it can change your mood and demeanor. We know that. Sometimes to a severe level. Chronic fatigue, most definitely. Difficulty falling asleep, staying asleep, poor concentration. Think about it. Let me stop right here a little bit, and we'll get to this a little bit later. Um, Poor concentration. Think about what copper is. It's a metal. We all need it, by the way, but not in overload. Your brain is also an electrical chemical organ. Now, think about this. Everything you plug into a wall socket has a copper wire. Why? Simply because it's a great conductor of electricity. Okay, so for your estrogen dominant female who has higher copper levels and higher percent free copper, free radical copper, and we'll talk about that later, in her system, it's simply going to sabotage some electrical impulses. It will scatter them. It will simply do a short circuit on what it is you're trying to think, whether it's an emotional response or you're trying to figure out a math question or you can't think of anything, your executive function seems to be walking out the door. It will absolutely sabotage your ability to think appropriately in your executive function. And so that's part of the reason why that happens. Okay, depression, most certainly the most severe cases have to do with postpartum depression and postpartum psychosis, which can certainly occur. Tinnitus, there are so many things that can cause that, but one of them may be actually copper overload. Headaches, most certainly migraines, temper tantrums, that's a whole nother world. It has more to do with the children of copper toxic women, fears and phobias, hair loss, that has to do with a copper zinc imbalance more so. Learning disability, sabotaging of thought processing, menstrual irregularity, of course, mood swings, PMS, panic attacks, and so on. So let's move on a little bit here. Okay, disorders involving copper toxicity, certainly autism, classic. I haven't seen too many kids at all that did not have some copper dysmetabolism in a huge kind of way. Considering that, one, their metabolism is off in terms of how they manage minerals and metals. Their metallothionein, which is the big protein that actually appropriates what everything should be in terms of minerals and metals. And if you think about it, I don't know if you know this, but most cells in the brain act like their own battery. And just like a regular, say, copper top battery or any other battery that you use, there are certain components within that battery that must be in their exact proportions for things to operate the way they're supposed to. Now think about this. You take a battery, any old copper top battery, whatever the heck it is, and you put it into the toy, the remote control, whatever the heck you're using. When that particular battery becomes low in its potency, it is simply because the electrolytes that are there, the minerals and metals that are there, are out of their appropriate percentages, and suddenly that particular battery, that toy, whatever it is, just kind of slows down and doesn't work right. Simple as that. Okay, so if you have a copper dysmetabolism or a mineral and metal dysmetabolism, your brain is not going to function the way that it should. Okay, simple as that. So whether it's autism, whether it's ADHD, and by the way, copper tends to absolutely make anybody, kids or anybody else, function with a lower capacity for attention and focus. Okay, it can certainly provoke anxiety because it kind of raises sympathetic nervous system responses. Depression, most definitely. Oppositional defiant disorder, this is where anger and tantrums and things like that come into play because processing is not quite right. And then frequent headaches. Oh yeah, big time. Pain, that kind of comes with that as well because nerves are stimulated beyond their ability to, let's say, suppress any kind of translation into pain. And so medications are often given for that. But if we can kind of control the free radical damage that's going on there, I think some of the headaches would probably black out. All right, so violent aggressive behavior, this once again has to do with more or less the misprocessing, put it like that. Let's move on a little bit here. Okay, ideal copper biochemistry. Generally, and this is from Men's Medical, we are very conservative in what we think is reasonably appropriate or normal. And we have seen that when certain levels suddenly rise beyond what is normal, and normal is kind of like a questionable thing. It's normal for that individual or not. But anyway, serum copper, 70 to 100 micrograms. Okay, that seems to be a reasonable functioning level. Copper zinc ratio between 0.7, let's say, and 1. That one's a little bit tricky. And a lot of people like to harp on, oh, the copper zinc ratio is off. Well, listen, if both of those levels are abnormal, the copper zinc ratio does not really have validity. For instance, if copper for us cutoff is 110, if it's 200 and zinc is 200, well, first of all, they're both off, but they're going to have a ratio of perfectly 1. No. That has everything to do with what is within normal limits and what is not. And so we will decide what that really means based on the chemistry that a person has. So let's move on a little bit here. So serum copper is above 110. We don't particularly like that. It usually means that there's going to be some level of difficulty in terms of processing. It may be minor, it may be severe, but it will be. And in actuality, anything that we see that's really above about 115 or so is usually going to be problematic. Okay, the copper zinc ratio 1.2, not the worst, but we'd rather see it between 0.7 and 1, as long as both of those numbers are reasonably within normal limits. So symptoms of copper overload will persist otherwise. Okay, the role of copper in the body. We need it. I don't want you to think that, oh, there's no reason that copper has any evidence with anything. Well, no, it really does. We cannot live without it. But once again, it needs to be in its proper proportion, its proper amount for us to function the way that we need to. And let's think about this. We need blood vessels. We break blood vessels. They get destroyed for whatever reasons they are. We have to heal. Blood vessels need to be there. Copper is essential for the development of blood vessels, or else we'd have problems and we'd all be dead, to be quite honest with you. So moving on, copper too much of a good thing? Absolutely. And the very worst of the worst of the worst of the worst is a female with copper dysmetabolism who indeed has an overload. Particularly, when does that happen at its very worst? It's really postpartum psychosis, postpartum depression when it's major depression. Those two things, intolerable and totally unacceptable. Her brain has certainly been short-circuited. She cannot think. And let's think about this. Why am I saying that? It's because, well, once again, your brain is it's an electrical chemical organ. So there's two places where things just simply can go wrong. Okay. If from a electrical standpoint, copper is a great conductor of electricity and there's too much free radical copper, it's like, just a hot electron doing damage. That's going to be a problem. It can sabotage everything. So her thinking is not there. She just as soon walk off the building, shoot the husband, drown the children, all the horrible stories that you've probably heard. And it's not that she wants that to happen. Her brain simply won't allow her to function and think the way that it's supposed to. And in terms of the chemistry of the brain, well, that's the other place where it goes wrong. If everything is being short-circuited, that means that right at the end of those nerve cells where neurotransmitters are being released, they're not being released in an amount that is appropriate for normal brain processing. And so in terms of what we do at Men's Medical is we have to deal with both the electronics as well as the chemistry at that level. Okay, moving along. Okay, I guess I kind of talked beyond myself here, but yeah, copper and neurotransmitters. Copper plays a role in mental health due to its role in the synthesis of neurotransmitters. Excess copper tends to lower dopamine. Oh, who wants their dopamine? Not there. It's the feel good. I won the lottery. Life could never be better. I had the greatest news in my life, and the exhilaration that comes with it. Nobody likes that, but let me tell you this. Once you have copper in excess and dopamine present in the same scenario, dopamine can stay dopamine. Your sense of over sense of well-being is just out the door because copper will take dopamine and kind of sabotage its effect, which is to say that the exhilaration will be cut off. It will be totally stomped on. It changes dopamine, and believe it or not, into first noradrenaline and then adrenaline. So your heightened panic, anxiety tends to take over. And so that is a problem when copper is in excess, and particularly if the percent free copper, the free radical that does the damage, if that is in excess, we're going to have some issues. The worst of the worst, we've got some things located down here on this slide are talking about anxiety, panic disorder, depression, bipolar disorder, ADHD, autism. Well, that's another topic we can talk about later. But yes, violent behavior, paranoid schizophrenia, because your brain is on sabotage. It's been taken over. All right. So now Walsh depression biotypes. These are combinations in addition to copper overload. And many of our patients, I almost never see any with just one thing, only copper overload. No, there can be undermethylation, which is a problem. Copper overload might be a major issue, causing a lot of toxicity. Overmethylation, also a problem. Pyrrole disorder and other things that are going on. And once you combine these things with copper toxicity, you really have a problem. You really do. Simple as that. All right, copper in pregnancy. Okay. Most women get through their pregnancy, even if they are, copper toxic, copper dysmetabolism. Why is that? Because that wonderful, most wonderful little parasite that's draining everything from you is also utilizing copper for growth and development. Once again, as I talked about in the beginning, no blood vessels, no baby. That baby is really your saving grace during that time period, simply because it needs blood vessels. It has to develop blood vessels, or else you don't have a pregnancy or a baby. And so that needs to take place. And so the wall gets hit once the baby is born, and the baby is, well, baby's out of there then. So now what happens to her? This becomes a real big deal. What is going on with this estrogen dominant female who just delivered? What generally happens is that her copper levels, if they don't come down to what's reasonably normal, can really start to sabotage her thinking process, period. Her ability to have any kind of executive function, her ability to have an overall sense of well-being that's meaningful, such that she can take care of this baby. And so we have seen in too many examples where this has been a huge, ridiculously serious problem. And once we have that female back to where her copper levels are reasonable, overall sense of well-being and general function do return. But we really have to watch those patients very, very carefully. So let's move along here. Postnatal depression, most people are aware of it. There's hardly too many females that don't experience, or maybe they just don't know that's what it was, a postnatal depression. It's, I won't say it's necessarily natural, but it tends to be something that most females will experience, particularly noticeable if their support systems are not in place. And so if their circumstances is such that they don't have the support that they need, then we may have some major issues relative to how this will manifest. And that can get to be a pretty serious issue. All right. Elevated serum copper levels in women with a history of postpartum depression. So the idea here is that this tends to get worse. There's the first child, because copper rises and never went quite back down to the baseline. Then there's another child within maybe only a year, maybe a year and a half, where copper levels tend to continue to rise. And then once the child is born, it's still at a high level where the risk factor for postpartum depression and psychosis are heightened, believe it or not. All right. This is actually an article that I had done with Dr. Walsh in terms of elevated copper levels in women with a history of postpartum depression. Eventually, this article eventually landed into Congress, for which there was a bill made to try to do whatever it takes to keep this from happening. And so I was a part of that study, and the bill that was made and passed gave me more motivation to try to make this something that we could avoid. And so I'm very, very passionate about women, estrogen dominance, and copper toxicity. That's just an article that was there. Okay, so the estrogen copper connection, I've kind of said it really. This is the one where, and let me say this. We're talking about women and copper overload. Not every woman on the planet, I'll say it again, has this issue. You do need to know that this is something that is generally a genetic predisposition, and it usually runs against the female line. And so if you think about your history a little bit, you think about your grandmother, your mother, your sisters, first degree relatives, and very often they will follow the same pattern in terms of the beginning of menstrual cycles, what happens during menstrual cycles, whether or not there's any problems in terms of heavy menstrual cycles, endometriosis, fibroid tumors, whether or not there was postpartum depression, any of that kind of stuff. And it tends to just simply follow that particular line. So when the balance is off, these kind of things can experience. They do. All right, let's move along a little bit. All right, birth control and contraceptives. All right, here's the problem. Here's part of it. All right. Birth control has its place. We understand that. We know what the purpose of that is. Hormone replacement has its place too, and I'm sure we'll probably get to a slide where that's being mentioned. But if you have an estrogen dominant female to begin with, and then you add more estrogen to that estrogen dominant female, we're causing more of a problem. The risk factor simply goes up a little bit more in terms of things that can occur. And a lot of times, I often use this term, a lot of women just simply cannot connect the dots. Who would if nobody tells you that when you add estrogen, more estrogen to the estrogen dominant female, you may have some issues that kind of translate into some symptoms that you don't know where they were coming from. Generally, the estrogen dominant female starts off at, okay, I'm entering hey, I'm joining the ladies club here at about age 12, 13, 14, whatever the heck it is. And for the estrogen dominant variety, for every single menstrual cycle that happens, her copper levels, which used to be baseline before any of this started, just creep up insidiously just a little bit. And then just a little bit more, just very small, with every single, menstrual cycle. And sometimes by the time the first child is born, her whole mood, demeanor just seems to change, and she doesn't understand why. What is wrong with me? I wasn't reacting like this before. I seem to be very emotional. I'm not getting it. This is just not me. Well, it was just not happening then. It was an insidious change in metabolism relative to estrogen dominance and copper dysmetabolism that eventually caused some of the issues that were happening. Okay, copper zinc imbalance. Once again, I kind of mentioned this before. I'm not going to stay on this slide too much. If copper and zinc are in their appropriate amounts, no big deal. Yay, we get a 0.7 to 1 in terms of that. They tend to want to, in a normal best of world scenario, be 1 to 1. That's great. It can be 0.7 to 1. That all works out very well. However, the deal is when copper is in excess, it suppresses zinc levels. When zinc is in excess, it suppresses copper levels. Well, that actually can work for you from a therapeutic standpoint. But particularly if you have copper really high, what the heck does that have to do with anything? Well, when copper suppresses zinc, here's the fact you should know. The rate limiting step to the production of neurotransmitters, and we're talking about serotonin, dopamine, GABA, histamine, whatever the heck they are, all neurotransmitters tend to depend on copper and zinc being in a decent ratio. However, when zinc is depressed, Zinc has to partner also with vitamin B6 in order to produce neurotransmitters. So if either one of those are low, there tends to be an dysregulation of neurotransmitters, which translates into mood and demeanor changes that are not really acceptable. Okay? So here we go. Slide 20, chronic fatigue and fibromyalgia. Okay, this is one of those things that we haven't really published as something extremely meaningful, but oh so meaningful it is. A lot of people with the fibromyalgia tag are actually people, even males and females, with copper dysmetabolism that's simply short-circuiting processes that have to do with the neuromuscular joint issue. Nerves are everywhere. Forget the fact that the majority of them are living in a brain, which is absolutely sensitive. But when you have fibromyalgia and you have electrical conduction and you have an overabundance of a free radical copper with hot electron just doing damage, guess what? You're going to hurt a little bit more. That's just how that goes. So anything that was a pain seems to be exaggerated. So that is indeed a real problem. And so what we're finding is that people who have this diagnosis tend to do a whole lot better if we can get control, I should say, of their copper dysmetabolism. So moving along a little bit. High and low levels of ceruloplasmin. So important, guys. You wouldn't believe how important this one is. And we've tried for years to try to figure out where and how we can make more ceruloplasmin. There is a hint, okay? And the hint is this: protein makes protein, okay? Ceruloplasmin is the protein that generally binds percent-free copper. And as much as my business partner, Dr. Amenza, hates me to tell this little story, I generally like to tell the story so that you can, from a metaphorical standpoint, understand what that means. Okay? Ceruloplasm is like the yellow school bus, and many of you who've ever seen me on YouTube or anything else know I kind of just default to that. Ceruloplasmin being the yellow school bus. Okay? What is the purpose of the bus? To pick up the children. The children are going to be free radicals at this point, for lack of a better explanation. They are the free radicals that they need to get on the school bus to be taken to where they're supposed to go. They're supposed to go to school, okay? If you don't have enough school buses, some of the children may opt to just get there any way they can. But however, on the way, they will get into trouble, join into gangs, kick the dog, right on the fence, do all kinds of damage to the neighborhood on their way to where they're supposed to go. Some of them won't even get there. And so the problem is, if you can't have enough school buses, some of the children are going to cause some difficulty. If you don't have enough ceruloplasmin, then your percent-free copper, the free radicals, they're going to do some damage to your tissue as well as your DNA. That's a problem. That's a real big problem. So how do you get more ceruloplasmin? Once again, ceruloplasmin is it's a protein, and protein makes protein. And this is where conservative management comes into play. So everything's not rocket science, that's for sure. If you eat enough lean sources of dietary protein, you will make enough ceruloplasmin. It's just that ceruloplasmin tends to be one of those proteins that kind of stands at the end of the line because it's not as critical as some other proteins that need to be made to keep you alive. Okay? But if you have enough ceruloplasmin, you'll make enough of it such that your percent-free copper, the free radical, okay, will be able to get on the school bus or bind to its protein. The less free radicals you have, the better off you are, the less damage you have. It's so simple as that. All right, slide number 22. Important stuff, extremely, breast cancer and oxidative stress. Well, where does that come into play? And there's two thought processes about this. We all, believe it or not, can walk around with 6 to 10 lethal genes. Okay, now there's a little bit more that goes into this in terms of what this really means. I'm going to try to combine it into the cliff notes of what I want to say, but this has to do a little bit with methylation. People who are undermethylated, there's a little bit of a tendency of a higher risk for them to develop cancers versus those who are overmethylated, but don't think that both types can't develop a cancer. They absolutely can, depending on circumstances and environmental changes that take place, and changes in DNA and aging and exposure to radiation and all that kind of stuff. We're not, it's not like we can avoid cosmic radiation and some other things that happen to us from an environmental standpoint. However, what this has to do with copper is what I want to focus on now. Once again, and you probably maybe intuitively have figured it out, since copper is important for the development of blood vessels, what we don't want to do is have copper around to the extent that it's actually supporting tumor tissue or some little cell that has messed up and started to develop into some sort of a tumor tissue process. You don't want to support the development of blood vessels that support tumor growth. And that's what this has to do with. Now, the undermethylation thing, we can talk about that maybe at another time in another podcast, but the undermethylation has to do with the fact that very often we're so wonderfully made until our DNA very often will harbor lots of methyl groups over bad genes. Okay. And if you keep taking the methyl off of the bad gene, eventually that's going to be exposed, and the reader, so to speak, will read that, and that will be translated into the next cell and into the next cell, which is why over time people develop diseases. But there's a whole nother world there. We'll talk about that some other time. Let's get to slide 23. So environmental exposures. Here we go. Birth control pills, copper IUD, synthetic bioidentical hormone replacement. Think about that. There's a little bit of, I don't know if you want to call it a myth or not, synthetic versus bioidentical, but believe it or not, bioidentical and synthetic still will raise copper levels. They just will. That's just how that is. And if copper levels are raised, then the risk factor for what happens in the sequela of that just tends to happen. So that's how that goes. All right, copper overload testing and treatment. Okay, physical exam. This is kind of like the Mensa medical thing and what we do. We do an extensive history. We do a physical exam. We do the laboratory test, targeted nutrient therapy to lower copper levels. In other words, yeah, there's something you can do about that. You try to raise ceruloplasmin. Vitamin C is extremely important. We use molybdenum, and we use what you call a Mensa medical enhancer, which is really a series of amino acids and also includes zinc and some other things that help to create more ceruloplasmin such that it will capture the free radical, which really does the major damage in terms of copper. All right, almost there, folks. Chemistries. These three are important. Now, we're making it look a whole lot easier than it really is, but it is indeed not rocket science, just very involved. But we need to check things like total copper, plasma zinc, ceruloplasmin, and from those things we can get the percent free copper, which is your free radical. It's important for us to know that it's hopefully between maybe 25 and 30% we can live with. More than that is a problem. Zinc, because these two guys, copper and zinc, have a ratio, if they can do it from 0.7 to 1, we might be in a good place. And so those things we absolutely need to know. And slide 26. Okay, so what I had done was kind of looked up a few cases that we had and what was going on at the time. So yes, there was a 53-year-old with mood bipolar disorder who was not taking hormone replacement. This particular person was just naturally estrogen dominant, and also the women in the family were estrogen dominant, and they were having very great difficulties. And this turned out to be a diagnosis that produced mood disorder, a bipolar disorder. And so once that was managed in terms of taking the copper levels down, the diagnosis itself didn't seem to manifest, or at least was well controlled. Diagnosis for us are just that. It lets us know what we think is going on, and we dive a little bit further in terms of biochemical individuality and trying to figure out, okay, this is where the root of the problem was here. All right. Then there was a 25-year-old, someone twice as young there, racing thoughts. That's kind of brain sabotage, acne, estrogen dominant, and as you know, very often we know this. Birth control pills are given so that the acne can go away. I still haven't figured out exactly why that is, but it does happen. Irregular menstrual cycles, and actually they're very, very heavy cycles. Sleep challenges because the brain is just wired and on fire. okay, anxiety and OCD. And this person was taking birth control pills where copper was indeed part of what was going on there. All right, so we made some alterations on the thing. We did not want to take away her family planning, but there are other things that you can do and other ways to family plan, that are just as effective, but you have to know what the chemistry and how that woman metabolizes to give her some advice in terms of what she can do. All right, the 74-year-old with sleep challenges. This was interesting simply because she's obviously postmenopausal for a while. And why on earth does she still have high copper levels? Well, because she just a genetic predisposition. It's just how she was. And it continues whether you are first starting a menstrual cycle or if you are postmenopausal. It is what it is. Check the chemistry, do what's necessary to put it in balance. And that's what happened there. So 53-year-old, well, about 3 or so years into menopause, who was doing hormone replacement, same kind of thing. Depression, didn't know where it came from, couldn't connect the dots, didn't understand why, these things were happening. They were worsened. They were bad when she first started menopause, but they got worse, believe it or not, with hormone replacement. All right, and this another female 24-year-old with symptoms, no birth control, no medications on board, nothing, just simply naturally estrogen dominant. And so we approach all of these ladies with the same therapy, depending on level of severity, will dictate how we're going to approach them. All right, here we go. Slide number 27. And this is actually a case where this was kind of interesting. And let me kind of put some of my own notes here. This is one of those where ceruloplasmin was 14.3. We start to wonder about low ceruloplasmins, and so we very often will advise those women to increase dietary protein, lower carbohydrate dense meals, eliminate or avoid as many sweet treats as possible. The bottom line is we're trying to build ceruloplasmin so that her percent free copper will go down. And even though this lady's total copper was only a low number, to be quite honest, because we kind of like it between 70 and 110. Hers was like a 58. Well, okay, it's got low copper. Nevertheless, the problem was her percent free copper was elevated just above what we call acceptable. In fact, as I calculated it, it was about 26%. And so 25 is our cutoff. So she still had issues. She still has issues that raise risk factors for things that can happen with copper-induced metabolism. The zinc level, okay, is actually a little bit higher than what I'd like to see. We generally don't like it above about 150. She had a 183. Now, that might work for her in the long run in terms of suppressing. Maybe that's why her copper level was actually suppressed, because when zinc is up, copper's down. When copper's up, the zinc is down. And so in a sense, that plays into it as well. We will also deal with this type of chemistry to normalize both zinc and copper to be closer to the 0.7 to 1.0 in terms of ratio. And overall, she will function a heck of a lot better. All right, looks like we're on the last slide here. Let's see, that's 26, went the wrong way there. Here we are. Oh, it's called Thank You. Okay, I would imagine all the things that I put out there may have generated a lot of questions, and at some point we're going to get to that as well. So at this point, let me kind of turn everything back over to the host and find out what else we're going to do from here.
Dr. Judy Bowman is here with us today, you guys. She is a leading physician specializing in the biochemical treatment of mental, emotional, and behavioral disorders. She is the co-founder of Men's Medical, where she's helped thousands of patients worldwide through targeted nutrient therapy. She trained under Dr. William Walsh, a pioneer in advanced nutrient therapy and biochemical psychiatry, and has dedicated her career to applying the science-based approach to supporting individuals with autism, ADHD, depression, anxiety, bipolar disorder, schizophrenia, and other neuropsychiatric conditions. I could go on too. There's more conditions on that list I'm not even naming. Dr. Bowman earned her medical degree from Finch University of Health Sciences Chicago Medical School and completed her residency in family medicine, where she was the chief resident. She also has extensive training in nuclear medicine technology from Northwestern University, you guys. She's deeply committed We love her to death because she's a great presenter and she's so sweet. And she's here to change the world. So, Dr. Bowman, welcome.
Thank you so much. I appreciate all those accolades. Really
Hey, you did it
what
all.
you're
I didn't
talking
do anything.
about.
I just used the internet to write your bio.
Mhm.
Gosh, I don't even know where to start, you guys. We have so many great questions.
Wonderful.
We've got lots of copper questions, and let's just start with this one. Lee asked, does elevated copper also play a role in lowered serotonin levels?
It does, in a sense, it's an indirect sense because when you have high copper, that tends to lower zinc levels. When zinc levels are low, we have a tendency not to be able to produce neurotransmitters that are going to be available in amounts that are going to be beneficial to you. So your overall sense of well-being kind of takes a dive. Your ability to calm yourself in a timely manner all kind of goes downhill. And even dopamine to an extent, life is wonderful. I won the lottery. That just tends not to be able to happen. Mhm.
Mm. What is the best way to help a client begin to lower elevated copper in a way that does not cause copper dumping?
Okay, it's called low and slow. It depends on who you're dealing with, or very often depends on what your level or severity of copper toxicity is, will determine how quickly you can do that. Because we have had cases where use of things like, and let me name them, well, ceruloplasmin certainly plays a part in this, which means that their ability to have enough dietary protein on board will help them make enough ceruloplasmin to pull really the percent free copper out, which is really the bad boy. But certainly things like vitamin C, certainly zinc, absolutely, because they have that relationship where one is up, it suppresses the other. And then we also use something called molybdenum. You may have heard of it. But molybdenum is kind of like your little taxi driver that kind of acts like the extra helper to help move percent-free copper out and lower copper levels in general. So you have vitamin C, you have molybdenum, you have zinc. And in our case, we've developed this product called Mensa Medical Enhancer that helps to build ceruloplasmin and also has zinc in it to lower percent-free copper and total copper so that the symptoms associated with it take a back seat. Mhm.
That's a great answer. Can you again go through? I'm going to share my screen when I get to the slide of that
Sure.
sample report.
Mhm.
But can you go over? A lot of people are asking about the ideal ranges or the ideal range for
Yeah.
copper, zinc, the ratio, and ceruloplasmin. We had a ton
Most certainly.
come in there.
Consider this, though, we're a little bit on the conservative side relative to testing and what mainstream might call acceptable versus not. And so, in terms of copper, and we're talking about serum copper when we're talking about testing, we're looking at levels that should be between, say, 70 as in 70 to about 110. So we can kind of deal with that as being reasonably okay as an amount to have for total copper. In terms of percent free copper, which is really the free radical bad boy that you calculate, we generally don't like to see it over 25%. We can accept 25 to 30%. And usually the acceptance there has more to do with, is that person on a hormone replacement? Is that person taking birth control pills or any type of estrogen-based therapy? And then we can kind of deal with 25 to 30%, beyond which you can anticipate there may be some issues. Zinc levels for us tend to be, we like them above 91 to about 150, seem to be therapeutically important. Anything less than that, they were at a little bit of a risk factor in terms of whether or not that's going to help with copper dysmetabolism. Mhm.
Perfect. I'm sharing my screen, you guys. You can see here the LabCorp reference range here, and we have the Walsh-Pfeiffer functional range here that Dr. Bowman's talking about, which is the guide. You know, when you're ordering these labs from DHA, this is the reporting that you're going to be getting, which has these reference ranges because the typical standard ranges we see in Americans, we know just aren't enough. And that's the reference ranges that LabCorp gives us. So we have the Walsh-Pfeiffer functional ranges there.
Correct.
Okay, this is a great question. We had a couple questions come in on estrogen dominance,
Mhm.
vegan, vegetarians, and can you get enough protein from plants to make ceruloplasmin? Can you kind of tackle all those at once?
We're designed that way. By the way, our nutrients are supposed to come from the foods that we eat. They really are. As most of you are probably aware, though, we've kind of done a little song and dance there with the plant-based and everything-based food, GMOs, blah, 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 and kind of changed things a little bit relative to the nutrients that are actually available. The potency does not tend to be as well as it should be. It really is not. Well, we are designed to get our nutrients out of our food. And so what we're finding is that when people have a deficit, very often, the one thing that can really help them is to actually supplement. And so that's exactly what we do. Of course, we do that because of, well, biochemical individuality. Every person is not the same as somebody else. And so you simply need to test the chemistry and see what that person actually looks like from a biochemical standpoint. And by kind of breaking them down that way, you can see exactly what it is that they need. And it's not, like I said, it's not rocket science and all in terms of how we go through this. You just need to know the level of severity and how to respond to that in terms of how much you're going to suggest that they can use to balance their chemistry. And the other part of your question, can you repeat that? Because that was kind of a two-parter.
Let's see. Let's just kind of shift focus here and go to another copper question. So how do you decipher whether serum copper is high due to overload or due to inflammation and an acute phase reactant? This is a question from Ryan. Thanks, Ryan.
But you know what? You look at numbers, but you also look at symptoms that people are having. And so when we are writing a protocol, and everybody should keep this in mind, it's not only about what the numbers are saying, but what kind of symptoms kind of correspond with that particular level. There are some women, say, particularly that respond extremely severely to just minor changes. There are other women who don't seem to have the same level of response. And so take into consideration the actual narration a narrative or whatever that female is telling you in terms of what her symptoms are, as well as what the numbers look like. And I've been surprised to see numbers that were, oh gosh, total copper was actually near 300. But okay, percent free copper has been somewhere between 20 and 25%. That gives you a little less worry than a copper of, say, 300 and a percent free copper of 60 or 70%. Because what you have in that second example is a live wire, which means that you've got this poor lady with a sympathetic nervous system that is riding very high. She's anxious. She's probably having panic that just occurs out of nowhere. She's possibly depressed. And these kind of levels, that second example, are also ones that you see with major depression or even postpartum psychosis. And so a level of severity is everything, and you have to take into consideration what your patient is telling you, as well as what their numbers actually look like. The bad boy, as I keep saying, tends to be the percent free copper. That is your free radical that generally causes damage. It does several things. Free radicals damage tissue. Free radicals damage DNA. You don't want your DNA compromised in any way. High percent free copper also does not let your neurotransmitter dopamine stay dopamine very long. As I was saying, it tends to turn it into noradrenaline and then to adrenaline. And so this is where part of her fight or flight anxiety panic can come from. And the other thing it does, it will certainly lower her ability to have enough energy. So she's mentally fatigued and she's physically fatigued at the same time. And so all of that is really a huge problem.
Can you get enough protein from plants to make ceruloplasmin?
Yes, you can. And very often what I will do is I'll look at a level that's come in and I'll say, okay, you can look at a regular old CMP and look at the albumin level and look at the calcium level and kind of correct what should be there and what shouldn't be there and kind of decipher whether or not this person really has enough protein in their diet. Let me kind of explain that a little bit more. I talked about it in the earlier parts of what was going on here. But if you have enough protein intake, as in lean sources of dietary protein, of course, you're going to have the concentrated amount from animal protein. It doesn't mean that, oh, I'm a vegetarian, so I won't be able to get that. Not at all. There are ways that can be done, and that can be done very, very well if you are following a plan, or at least know a nutritionist or dietitian that can help guide you of where protein sources can come from. Some people are just taking a simple protein shake. That's wonderful. That's very fine. You can do that. Bottom line is, ceruloplasmin is not one of those proteins that stands in the front of the line when your body is making protein. It is not one of the proteins that say is critical for life itself. You're going to make everything else your body needs, which means that your muscles kind of stand as kind of number one, and we need protein more than anything else. But there's other proteins, obviously, that are made. Ceruloplasmin is kind of towards the end of the line and says that, hey, if there's enough left over for me, then I can make enough to capture percent-free copper. This is not a hard thing for that to happen. The bottom line is, we don't always eat the way that we're supposed to. And so we have to be very conscious when we're quite aware that there's not enough protein to be made. Very often we see that, of course, in the chemistry. We generally advise that person, listen, increase your lean sources of dietary protein. Decrease your carbohydrate dense meals and your sweet treats, because take a conscious look at what it is that you're eating. And it doesn't have to be something that you need to be OCD about and jot down in terms of exact amounts. You just need really the physical evidence that there's enough protein going in. And so if it looks like you need more, perhaps you're doing it by a protein shake. Perhaps you're having or being guided by a dietitian or someone who is really savvy enough to help you with your protein intake. And if you're smart enough, and many people are, you can kind of log yourself exactly what it is that you're eating and keep up with the amount of protein that's going in. So that it does really serve two purposes in actuality. And even though I'm not really talking about methylation and methylation profiles and cycles and whatnot, it also helps you to increase your level of methylation, which by itself can turn on enzymes, hormones, proteins, and neurotransmitters to do their job. So since we're so wonderfully made, and since there's so much multitasking going on relative to supplements and what they do, I would highly advise both of those techniques. So enough protein in your diet can actually raise your ceruloplasmin, I should say, and make your percent-free copper much, much lower, because that is really the target that you're looking for relative to any symptoms that might be provoked if that is too elevated. Mm-hmm.
Mm-hmm. That was great. Somebody just asked if there is a lab that DHA offers that contains all of these chemistries. And I can answer this myself. Dr. Bowman, if you want to add something, you totally can. Thank you for this question. But on the top section of your DHA practitioner portal is our brain chemistry testing section. You'll see zinc, copper, ceruloplasmin, cryptopyrrole, et cetera, et cetera. And also those three chemistries lie in all of our metabolic panels, which if anyone's familiar with those, we've talked a lot about those.
Absolutely. We depend on,
Oh,
you really do. And just a caveat,
yeah.
understand it has to be serum copper. We didn't ask for plasma or serum copper, although they can be very, very close. We can use it. That's what we have. But we generally specifically ask for serum copper, plasma, zinc. So those are the ones that you're going to think about. Those are the ones that we actually use to make calculations. And so that becomes very, very important. Form is very, very important in terms of what it is that we're asking for. And this lab has been particularly trained to make sure that those specimens are the ones that we get. Mm-hmm.
Mm-hmm. That reminded me of a really great question I saw come in. Let me find it. Somebody mentioned that let's see, Carrie is saying, I recently got some results that didn't seem quite right for my patient. Have you seen issues with reliability of reporting in zinc or copper from standard labs like LabCorp? And another guest today actually said, hey, I got 2 reports of like 0 copper on a patient. What's going on here? So what do you think about the reliability of the testing?
Well, sometimes I'll have things repeated, like any lab. Labs make errors, guys, and very often, somewhere between 2 and 3%, you can build in lab error. And so, if something looks a little strange, or if you're watching several things that you actually have ordered and they seem a little high or they seem a little low, a little abnormal of what you'd expect, simply call the lab. You may need to have something repeated. And very often, before you put out a therapeutic modality, you want to make sure that that is indeed what it is. And so, very often, we will repeat labs. Very often they will come back maybe the same, for which we're raising all kinds of flags as to what's going on with that patient. But for the most part, I would say repeat a lab that you have a question about. It's just that important because that's going to guide your modality in terms of how you're going to treat that patient and what type of protocol you're going to make up for them. Mm-hmm.
And then, is there a reason that you order zinc and copper through? You're a physician yourself. You could order straight from LabCorp if you wanted to. Is there a reason why you're ordering through DHA instead of just by yourself?
They are absolutely the very best in terms of specifics. These labs have been trained and know exactly what it is that we need. This is not like, oh, new kid on the block kind of scenario in terms of ordering. There's specific training that comes along with exactly what we need. And so we've been going through direct healthcare for I don't know how many years, at least maybe 2, possibly 3 decades. And so the reliability, we very much have a lot of confidence within that lab. It's like the lab as far as we're concerned in terms of reliability. But, like any lab, there can be changes that happen. There can be some standardized protocols that seem like they're a little bit off. Which is why the quality control is always in such a great shape. And so when things need to be repeated, they can be. And very often when that happens, you have to call a lab and say, I think that there's something going on. And the good news is they're very, very, very astute at figuring out what's happening. And very often also, if it looks like there has been a problem, they've been very, very reliable to make those corrections as they are needed. And so we really rely on direct health care along with their collaboration with LabCorp to give us the information that we seek. We really do.
Perfect. Thanks, Dr. Bowman. We had a couple questions about HTMA. Do you take HTMA, hair tissue mineral analysis, into consideration ever, or are you just looking at serum?
Oh, no, no, no. Here's the deal. If you can look at urine, hair, and blood and see how that actually helps you to make your protocol, it's a comprehensive sort of approach. Your hair basically is it's a waste material. I hate to say that. It can be pretty, it could be not, but nevertheless, it's going to tell a story in terms of how you're metabolizing what you're metabolizing. And we very often will do a hair analysis to see exactly, say, in terms of copper, what you're doing with it. If you are a really great copper excreter, more than likely that line is going to be towards the right in the yellow or in the red, which is actually a good thing. It does not mean that person is high copper. It means that that person is a very good copper excreter and is getting it out. And a lot of people really don't understand actually how to read a hair analysis. Each thing on that hair analysis, each metal, each mineral has its own story. And that's really how you have to look at it, mineral and metal. One a piece. And in actuality, you also look at that. You look at the total number that is there compared to what the reference value is, but you also have to look at how it's related to all the other metals. So just in talking about copper, high numbers usually mean great excreter, and that's a good thing. They can get rid of it. Low numbers usually means not so great of an excreter. And in terms of even zinc, because we like to look at those relationships together, zinc flowing to the right means that, oh no, zinc waster, when in fact in the serum it's probably low and in the hair it's probably elevated, and we really do not like to see that. And so it matters how you read a hair analysis. It matters what's in the blood, it matters what's in the hair and what's going on. That kind of gives us a comprehensive view of what that patient is doing and what their metabolism is really going to be like. And that also dictates how the protocol is provided.
That was a great answer. Dr. Bowman, you said that up to 20% of women suffer from postpartum depression. Of
Mm,
those that you get to treat, what percentage get better once you balance their zinc and copper? I am specifically looking for clinical outcome data,
absolutely. And I
asks
haven't seen
Dr.
anything else.
Handel.
Yeah, I'm just not going to say anything else. I haven't seen anything fail relative to some level of
Wow.
improvement. I really have not. And once you can manage that, you can get chemical balance for that particular female. She almost always responds in a positive sort of way. Sometimes even surprising us in terms of the levels that are managed once that is actually handled. But all of them seem to, as long as they're compliant, don't forget that part. Compliance is key. As long as there's compliance built into this, there's almost always, I can't think of one incidence where they haven't improved. I really haven't. Mhm.
Thanks, Dr. Bowman. Dr. Latham is asking which lab do you use for HTMA? Chris, I know that Men's Medical uses doctors' data,
Generally.
HTMA, and that is on your provider portal, DHA Labs. So the first section is the brain chemistry testing. Then you guys have your clinical chemistries. That's all the blood chemistry you can order. The functional third-party kit is at the very bottom, and doctor's data's HTMA is
Yeah,
on there. If you have a hard time finding it, let me know, but it's super easy. I would just go Control F, doctor's data, and you'll pull it right up. So you can add that to your order with the blood chemistry when you guys, place your order on your, patient who could really use help with these specific chemistries. So I want to
absolutely.
get into the nitty gritty of treating people who have excess copper. I know that you went over some dietary things to do to reduce copper. Can you quickly highlight those again before we talk more about specifics, protocols, and what to do when like zinc is this, copper is this, et cetera, et cetera?
Sure. So the first thing that comes out of my mouth really is increasing lean sources of dietary protein to allow your ceruloplasmin to build. Once you can do that, it's going to help take the percent free copper out, which is, like I said, the free radical that really causes the damage and the problem. The bottom line is the free radical copper tends to cause problems in her brain because your brain is an electrical chemical organ. That being the case, I always like to remind you that copper is a great hey, that's why it's plugged into everything in the wall. There's a copper wire there, great conductor of electricity. And so if you have a situation where your brain chemistry is off, that's one thing. But if the electronics is off, that's another thing. What you don't want is brain short circuiting. And so that means that things that are supposed to happen in terms of thought, processing information, or whatever it is, are not happening the way that it's supposed to happen. So whether she's trying to answer a math problem or trying to figure out her executive function or just what it is that she's supposed to do from an emotional standpoint of reaction, those kind of things can simply be sabotaged if your high percent free copper is off. It's kind of like having, as I gave an example, maybe trying to get to grandma's house, but the wolf is in the way. The wolf is ready there to sabotage everything that's going on there, including you getting to grandma's house, or having gang members congregate on the corner waiting for you to come down the street so they can totally mess you up, or the little example of the little yellow school bus where the yellow school bus is ceruloplasmin and the little kids are outside the bus. Bottom line is, if you don't have enough school buses, you don't have enough school buses to let the kids on, so that some of them are going to get into trouble. They are, and they're going to do some kind of damage that is not going to be beneficial to you. And so, if that helps you from a mental standpoint, kind of a metaphorical look, understand the relationship between ceruloplasmin and free radicals and free radical damage, then try to remember that. Bottom line is, you need enough ceruloplasmin to capture the percent free copper. And this is where also a little additional help with things like molybdenum come on board. They kind of act like, oh, okay, not enough ceruloplasmin, but there's some taxis that can pick up some of these school children and take them to school, or the free radicals and take them out of their action. So bottom line is there are many things you can do to remove free radicals, and it's not just copper necessarily. We look at all minerals and metals that need to be in their proper proportions. Very often a protocol, and what we use, of course, is a compounded regimen to try to really fill in the biochemistry that needs to be filled in. Some things are going to be an overkill. Some things are going to be not enough. Bottom line is, once again, the idea is balance. It's balance.
Let's take a case study. Lee Welty says, do you recommend taking some supplemental iron when plasma copper, percentage-free copper, and copper zinc ratio is elevated and ferritin and zinc levels are low? I have a client who's copper dysregulated. Her doctor is insisting she continue to take ferrous sulfate to elevate her ferritin, but she's not taking into account elevated copper. How do I support her?
I definitely, knowing those circumstances, we will definitely supplement with iron. Very often we do. We find that to be a problem with not a lot of women, but definitely with some. Menstrual cycles will certainly lower your iron levels, your ferritin storage. And so when that is the case, we'll very often supplement with it. And I think it's actually a great idea and can happen and should happen if it needs to be. Mhm.
That was a great answer.
Mhm.
Okay, yesterday I calculated the free copper percentage for a female child with autism. The percent was less than 0. Have you ever
Mhm.
seen a level that is less than 0?
Oh
Copper's
yeah, they come
101,
back. Yeah, we're talking about lab
zinc
errors
is,
here. It's a zero.
yeah.
Just call it zero. You can call it whatever it is. It's low. Put it like that. Low is not a problem. High is the problem. And so it's like, oh my gosh, this can't be minus whatever. But zero is zero. And usually when I see that, I just simply put a zero there, basically. Believe it or not,
Mhm.
it can and just happen. Okay.
It
Sometimes
does happen.
some females that have a great deal of ceruloplasmin, they are great producers of it. And when that happens, they're just none that looks like free that's there. Their total copper could be normal or could be high, but if there's no percent free copper, there's just no percent free copper, at least at that time. That too can fluctuate. It often does. Copper is released kind of on a feedback sort of mechanism. And it can go from zero to whatever the heck it is. We just don't want to see it above 25 to 30%, put it like that. Mhm.
Mhm. What happens if you have seizure activity on this biochemical electroactivity on the brain health, hormonal cascade, xenoestrogens in the environment? I believe this is key to schizophrenia and bipolar disorders, but what do you have to say?
Okay, and then we have several patients that have seizure disorders to begin with. And then we have several patients that actually, oh, you know what? We don't have very many that develop seizures, put it like that. There's most of the time what we get are patients that have a seizure disorder, and that could be caused by many different things, that's for sure. Certainly, an elevated sympathetic nervous system can contribute to that. Low sodium levels in terms of electrolyte imbalances can contribute to that. Some type of other conditions that are going on that perhaps haven't been diagnosed, but whatever it is, if there is a seizure disorder, the tendency is to absolutely try to lower copper levels to whatever is within normal limits to try to keep percent-free coppers at a level that are at least below 25% if possible. Do not give that person anything that's going to lower their seizure threshold. So things like manganese, of course, are going to be things that you do not want to give. It lowers dopamine, it lowers seizure threshold. And so those things are problematic. And this is where you have to put on your mainstream hat and look at the total person's medical history. If there's a trigger that tends to be there for seizure disorders and things not to do in terms of nutrient supplementations that might be problematic. We tend to stop things like both evening primrose oil, omega-3s, believe it or not. We don't give manganese. We tend to increase magnesium because it tends to be helpful in terms of raising the level that would be, well, there's lowering the seizure threshold and there's raising it. Okay, which means that you're going to be less likely to have a seizure. And those are the kind of things we're going to concentrate on in terms of any kind of seizure disorder. But with seizures also in the category come things like tics, Tourette's, okay? And very often, yes, indeed, there's an association between sometimes schizophrenia and psychosis in certain areas of the brain that are local that tend to provoke not only a diagnosis of mood disorder, but also seizure disorder. And in many cases, that seizure disorder is actually part of what's going on there in terms of a copper dysmetabolism and electrolyte imbalance. So those are things where you put on your mainstream hat and look into them in that way, from that perspective as well. Mhm.
Mhm. Is it possible to address high copper if somebody is on a vegetarian or vegan diet and their diet is rich in cashews, chickpeas, sunflower seeds, mushrooms?
It's just
Because
called
they
don't do that. Don't
I
do it.
know it's like
You
tough.
know,
Like how do you get around it? It's just a supplementation game, but how far can supplements go when their diet is excessive in kale, almonds, pecans, things like that,
mhm.
cashews?
It depends on who you are. And if you do have a copper dysmetabolism, the idea is to limit those things. I'm not saying they don't have a value, a nutrient value. Of course they do. But there's a limit of what you can take in terms of how your body's going to metabolize that and either give you trouble or not. And so then almost like if you look at diabetics, okay, well, you know what? Maybe they can have a little slice of cake, a little piece of whatever it is that has some sugar base, but heaven forbid they cannot have two or eat half the cake because they're going to simply push the override button, okay, and it's going to be a problem. And so very often it's the amount of what it is that you're eating that can be problematic. If you like your vegetarian meals and whatnot, it means that you can't push the override button and eat more than what your body can actually use and metabolize. So those considerations have to be had. Because I've had people that say, oh, listen, I eat a very healthy diet. I have an avocado every day, along with my kale salad with almond sprinkles and blah, 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 whatever else is going in there. And that's clearly a high copper diet. Well, if your body doesn't have a copper dysmetabolism, perhaps you manage that just perfectly fine. However, if it does, it means that you can't do that, not at those particular levels. And there should be a limit on how much you can do and when you push the override button, which causes you some detriment relative to that. Mhm.
Someone, Beverly's asking, Dr. Bowman, do you offer courses to healthcare professionals to learn this very important and comprehensive modality to help correct these hidden imbalances in our clients? Beverly, I am going to let her speak, but I know that her and Dr. Bowman over at Men's and Medical do offer consultations for providers like you, so you can inquire with them. And if it's a good match, they
Mhm.
sometimes will work with providers at a consultation rate, and they'll also sometimes take on mentees. So Dr. Bowman, you can say anything else in addition to that, but it
Oh, I
is
think you
there
said
for
it for
you
me.
and
No, I
their
think
doors open. Email them.
right. I think that's the best way to handle it, and you are correct. I don't really need to repeat that. That is exactly correct.
Perfect.
Mhm.
All right, let's do a couple more questions. We're getting so many and it's hard to not re-ask questions. So this is you mentioned manganese. Can you explain again why we should avoid manganese?
Okay, I can tell you quite a few things, even some stories from Dr. Walsh, who decided that, no, you know what, we should kind of shy away from that one, simply because it lowers seizure threshold. Don't like that idea at all. Also raises blood pressure. And so, though it has some validity in terms of using it for things like blood sugar management, that's all fine, well, and good, but it comes with a lot of risk, and we tend not to use it as much as we used to. We I had some stories from Dr. Walsh that said, yeah, you know, a couple of patients kind of ended up in the emergency room with blood pressure levels that were way too high. And it's because, well, they were utilizing way more manganese than what we had suggested, or they were having more seizures than what they are actually used to. Manganese actually lowers dopamine as well. And I don't know if you want your dopamine lowered necessarily, but it's not a good idea. It also will contribute to tics and Tourette's and a lot of other things like pyramidal issues in terms of extrapyramidal issues that look like Parkinson's. No, thank you. And so we tend to kind of stay away from using manganese unless there's some really specific reason why it's needs to be on board or tolerated. We tend not to want to go there.
That was a great answer.
Mhm.
Oh, thanks for that. So, Meg, I can send you that information. Ooh, this is a really good one. So, what modifications would you make to a protocol for a pregnant woman with high free copper?
Okay, let's talk about pregnancy. And of course, the big deal there, because All of us who have taken prenatal vitamins and whatnot know that nutrients are absolutely important, as they would never try to include them. But in terms of what we generally do, yes, we believe that things like, I just have to say it, we're going off of copper a little bit. Folic acid is absolutely a good idea for those who are thinking about pregnancy. And for us, we tend to limit it to about 3 to 4 months within pregnancy. Bottom line is now we're thinking about two individuals, the female as well as whoever's living inside of there. At that particular point, though, you actually start to influence the biochemistry of the child. And so then generally we kind of cut that off in about 3 or 4 months. And here we're just talking about the folic acid component. The other components that are generally in prenatal vitamins tend to be appropriate and okay. And that's because the baby itself is really utilizing that for growth and development and the development of blood vessels. And you're going to see in pregnant women copper levels that are exceptionally high. And that is exactly what should be happening. Natural physiology says this must happen because you need the development of blood vessels. No blood vessels, no baby. The baby is utilizing this, okay, to grow and develop, and it needs to happen. The problem is when the pregnancy is completed, once the baby is delivered, then what happens to mom? And can she, from her own metabolism, get her copper levels down to something that seems to be reasonable and normal? Because if she can't, this is the story that kind of leads to postpartum depression, postpartum psychosis, if it's really severe. And so that's where those things come into play. Mhm.
Thanks, Dr. Bowman. When, if ever, do you use genetic testing? I know sometimes it identifies variants relative to potentials for copper, zinc, ceruloplasmin, iron, dysregulation, etc. This is a question from Bonnie.
Okay, you can use it. Now, to understand this, it's the big thing now. I'm loving the fact that it is around and can give you some really good information about certain things. However, because you do genetic testing doesn't mean that this is exactly what your body's going to do. All of us are running around with 6 to 10 lethal genes that are not manifesting, but the gene is there. Okay, there's a lot of things in terms of genetic testing that is very valuable, that has more to do with medications. I think that's a great place to be in terms of that. And even whether or not you've metabolized certain nutrients. And I think that that is also some very useful information. For us, though, it just means that we are more able to select what it is your body is going to metabolize and what it's not. You know, we do have some opportunities where we can utilize that. So it does have a place. It doesn't always mean that because you have that gene that there's a manifestation going on. However, there's what your body's doing, and there's also the blueprint. Okay. Genes also turn on at different times in life. It's why we all don't look like babies. It's because we are changing. They happen also when puberty is on board. You're kind of settling into an adult chemistry, which is why for children particularly, we are very careful about following them a little bit closer because they're changing all the time. And so as we get older, there seems to be some diseases that people tend to develop a little bit more. It's because genes, once again, have time zones where they turn on and some of them turn off. Okay. And I have to go into it a little bit more in terms of how methylation plays into that, because it does. Methyl groups also, other than turn on enzymes, hormones, and neurotransmitters and proteins and all that, they also tend to cover over sometimes genes that really do not need to be exposed. And if one tends to demethylate a little faster than what you would expect to happen over a lifetime, you get manifestations or exposures of genes that are actually written there. Okay. So, and we didn't talk about things like Wilson's disease, but that also plays into the whole copper dysmetabolism scenario. If that gene is present, it manifests usually at a particular time, somewhere between 18 years old and maybe 40. And it's another change where, and we do have patients that have Wilson's disease that are very well managed because we can keep their copper levels down in addition to what mainstream is doing. So there's a lot of things to be considered relative to gene pool metabolism and what's your blueprint, your natural blueprint, and how that blueprint can change depending on what genes are exposed.
Thanks, Dr. Bowman.
Mhm.
Stephanie is asking, is there a copper link with thyroid and low metabolism?
Oh, what a wonderful question. So the links are this. Fibroid tumors, endometriosis, heavy menstrual cycles, and female cancers. Okay, so copper, what? It is naturally present, and it's because of its ability for angiogenesis, the production of blood vessels, is where this plays. Okay, and so then with the first menstrual cycle, the idea, okay, there's an estrogen surge, copper tends to be activated or come into the system, and when that happens, you get development of blood vessels in the endometrial lining of the uterus for the purpose of creating a wonderful little place for embedding of that little morula, embryo, whatever you had there. And growth and development happens because there's a great blood supply. Okay, if there's no fertilization, then you slough off and you have your menstrual flow. But if there is, the baby's going to use that copper, so to speak, and the blood vessel that are available to it to grow and develop into a baby. So that's just generally how that goes. However, for women who tend to be estrogen dominant, if there's an endometriosis scenario where you have normal tissue just kind of breaking loose and embedding itself in the pelvic cavity, very, very painful sort of scenario. Nevertheless, blood vessels are there, and every time there's a menstrual cycle, there is bleeding that becomes very, very painful. If it's a fibroid tumor, then there's a little outgrowth of normal tissue once again in your estrogen dominant female, where copper is helping the development of blood vessels to feed growth of that particular tumor. So it's heavy menstrual cycles, the same thing. It has to do with the development of blood vessels and whether or not there's heavy bleeding, endometriosis, or fibroid tumors. They're actually the same sort of process is going on relative to development of blood vessels and feeding blood vessels. Mm-hmm.
Anita has a really great question. If a woman is going into menopause and has been balancing copper overload, can they take bioidentical estrogen? Can you increase the nutrient therapy higher to keep the serum copper and free copper under control?
That's what we do. It's like, okay, here's a woman over a lifetime who has been estrogen dominant. Okay. And so now she's at a point where she's menopausal, perimenopausal, and it does not change her genetic predisposition toward having high copper, even though she's perimenopausal, menopausal. And so what you do is kind of counter that with items that help to lower copper levels. And so once again, you're looking at zinc, you're looking at raising our ceruloplasmin, you're looking at using vitamin C, you're looking at using molybdenum. Once upon a time, even in cancer therapy, bottom line is you do not want the growth of tumors of any kind of cancer to be supported. So the idea was to lower copper levels. They used to do it as a part of the basic protocol with tetrathiomolybdenate, as in molybdenum, a powerful sort of a chemotherapeutic sort of option that would help to lower copper levels such that blood vessels would not support the growth of tumors. And this is where it came from. It started in cancer research. Okay? Mm-hmm.
How often should copper be retested after treatment, whether you're looking to lower or raise copper levels? Great question from Mary.
Sure, it could happen anywhere between 3 to 6 months. Kind of depends on the metabolism of the person. But if we see a lady, particularly, who has really high copper levels, and we want to know the trending, it doesn't mean that we're going to test in 3 months and it's all going to be wonderful, but we want to see that the trending is going down and not up or just staying the same. And so somewhere between 3 and 6 months, you can check and see for trending of copper levels. Yeah, assuming she's compliant.
Shaman is asking thoughts about copper toxicity in pregnant women and children born who later identify with gender dysphoria.
Mm-hmm.
Any thoughts on that?
There's a connection only in terms of the research that we have says that copper dysmetabolism, particularly among females, tends to be more of a maternal line, tends to be, okay? So great grandmom, grandmom, mom, and then daughter tend to be that line of females that tend to respond the same in terms of copper dysmetabolism and genetic predisposition. However, you can indeed have males that have high copper. And when that particular predisposition is transferred to a male, what you get is a male who's very impulsive, who's very inattentive. So attention and focus tend to be a problem, who's just very much so a little bit of a jumping bean and a live wire, and they tend to also have irritability, moods, agitation. It tends to be like that if it's to a male. To a female, same kind of thing, only more geared towards what's happening when she joins the ladies' club. As a female, younger than that, though, some of the same traits relative to impulsivity, agitation, irritation, attention and focus issues can also be a part of that. So all ADD is not necessarily due to other things. It can be indeed part of high copper and high percent free copper.
Dr. Bowman, we're going to do 2 more questions, then I'm going to let you run. You guys, reminder, I just posted the link of the survey. I'm going to share my screen. You guys are getting 25% off copper, zinc, ceruloplasmin when you run it on any patient between now and Wednesday. You can use that code as many times as you want. For everybody who registered for this event, they can use the code twice. That's only 2 patient orders because you guys took the time out of your Friday. Happy Valentine's Day. We are offering it to you as many times as you can run it on patients. These chemistries are so important. So I'm going to share my screen as Dr. Bowman answers this final question after the next question I ask, but this is a really good one. And then Michael, I'm saving your question for last because I love it. It's like you work for DHA. Okay, Aisha says, what would flag you to look for Wilson's disease when checking copper, ceruloplasmin, and zinc levels?
Low copper and low ceruloplasmin. Those are the 2. So there are patients that actually have that. Oh, ceruloplasms are down to something like a 3 or a 1 or 2 or maybe even an 11. So we start looking at about 14, somewhere between 14 and 17. We might raise a flag in terms of I wonder if we should look for Kaiser flasher rings or have a test to find out whether or not this person has Wilson's disease. And so the copper levels are also very low. It's because the copper is hiding somewhere. It's hiding, so whether it's the liver or someplace else, it's going to be low when you check a serum copper. That's almost always a flag, almost always. And like I said, we do have patients with Wilson's disease that are managed pretty well, somewhere between both mainstream medicine and what it is that we do.
Thanks, Dr. Bowman. Final question here from Michael Warner. Michael asks, what are your thoughts on testing for different forms of copper and zinc? Plasma versus RBC, which do you prefer to check and why?
Serum copper, plasma zinc. Those are the ones. And that comes from testing all different kinds before. This is what Dr. Walsh did initially. There's probably variations on everything that we test that he's tried to test to find out whether or not we can get the best value of what it is we need to know. It turns out the calculations that we make tend to be best if you use a serum copper. You can use a plasma copper. It's going to be reasonably close. And if that's what you have because of whoever ordered it, then okay, fine. You can kind of go with that. You can still make calculations, but we prefer a serum copper, a plasma zinc, and very often a whole blood histamine. That's for a different reason, but that tends to be what we order. And ceruloplasmin pretty much across the board. There's not too many labs that really mess that up. It's pretty standard, and wherever you get that from, okay, is probably going to be okay and acceptable. Okay.